Prevention and treatment of pulmonary tuberculosis. Tuberculosis is an infectious airborne infection caused by Mycobacterium tuberculosis. Mycobacterium tuberculosis primarily affects the lungs and spreads from person to person through tiny droplets released into the air via coughs and sneezes. Sometimes the infection does not cause any symptoms. This is known as latent TB. It's called active TB if you have symptoms and if it makes you sick. However, in some cases, symptoms might not develop until months or even years after the initial infection. It's important to get treatment for latent TB even if you have no symptoms. You can still develop pulmonary TB infection in the future. Active pulmonary TB is treated with a combination of many medicines. Pulmonary TB is curable with treatment, but if left untreated or not fully treated, the disease often causes life threatening concerns. Treatment for tuberculosis usually involves taking antibiotics for several months. The exact length of time will depend on your overall health and the severity of your TB. You will need to take these drugs for 6 months or longer for the best results. After taking antibiotics for 2 weeks, most people are no longer infectious and feel better. However, it's important to continue taking your medicine exactly as prescribed and to complete the whole course of antibiotics. If you stop taking your antibiotics before you complete the course, or you skip a dose, the TB infection may become resistant to the antibiotics, leading to multi-drug resistant TB. The most common TB medicines are isoniazid, pyrazinamide, ethambutol, and rifampicin. If a person is not taking all the medicines as directed, a provider may need to watch the person take the prescribed medicines. This approach is called directly observed treatment short course. DOTS is a strategy used to reduce the number of TB cases. In DOTS, healthcare workers observe patients as they take their medicine. Left alone, many people with TB fail to take all their medication and continue to contribute to the spread of drug resistant TB. You may need to stay at home or be admitted to a hospital for 2 to 4 weeks to avoid spreading the disease to others until you are no longer contagious. Rifampicin can reduce the effectiveness of some types of medication, so it's important that your TB team know about all of the medicine you are taking before you start treatment for TB. Multidrug resistant TB. When people do not take their TB medicines like they are supposed to, the infection can become resistant to treatment. This means the medicines no longer work. Multidrug resistant TB is strains of TB that are resistant to the antibiotics used to treat the condition. It requires a much longer course of antibiotics between 9 to 24 months depending on the strain, and 6 or more different medications may be needed. Extrapulmonary TB. TB that occurs outside the lungs can be treated using the same combination of antibiotics as those used to treat pulmonary TB. TB can infect any place in the body, the inner organs, bone, the brain, and the spine. The most frequent forms of extrapulmonary TB observed were skeletal TB and pleural TB. Vaccination for TB. Some countries with a high incidence of TB give people a vaccine called BCG to prevent tuberculosis. The BCG vaccine, given as a single dose, offers protection against TB. It's often given to infants and children. Preventing the spread of pulmonary TB infection. It can be difficult to avoid contracting TB if you work in an environment frequented by people with TB, or if you are caring for a friend or family member with TB. You will not usually need to be isolated during this time, but it's important to take some basic precautions to stop TB spreading to your family and friends. You should stay away from work, school, or college until your TB treatment team advises you it's safe to return. Always cover your mouth, preferably with a disposable tissue, when coughing, sneezing, or laughing. Carefully dispose of any used tissues in a sealed plastic bag. Avoid close contact with other people at home and sleep in a separate room. Air out rooms regularly. Open windows when possible to ensure a good supply of fresh air in the areas where you spend time. Anyone exposed to tuberculosis should be tested even if they show no symptoms. TB is preventable even in those who have been exposed to an infected person. People who have been exposed to TB should have a skin test as soon as possible and have a follow up test at a later date if the first test is negative. Prompt treatment is very important in preventing the spread of TB. Possible complications. Pulmonary TB can cause permanent lung damage if not treated early. It can also spread to other parts of the body. Medicines used to treat TB may cause side effects, including changes in vision, dark colored urine, rash or itchy skin, fever, jaundice, liver inflammation, upset stomach, nausea, vomiting, diarrhea, loss of appetite, tingling in the hands and feet. Isoniazid can cause nerve damage. You will be given supplements of vitamin B6 to take alongside it to reduce this risk. A vision test and liver function test will be done before you start treatment so your healthcare provider can monitor any changes in your health. Contact your TB treatment team if you develop any worrying symptoms during treatment. What to avoid if you have tuberculosis? Quit tobacco. Avoid or quit drinking alcohol. Limit coffee and other caffeinated drinks and limit refined products. Outlook is excellent if pulmonary TB is diagnosed early and effective treatment is started quickly. Symptoms often improve in 2 to 3 weeks after starting treatment. Thank you.